Welcome to the Stay Healthy El Paso podcast, where we help El Pasoans get away from taking pain medications, avoid getting injections, avoid surgery, and keeping up an active lifestyle. This podcast is presented to you by Dr. David Midoff, expert physical therapist and owner of El Paso Manual Physical Therapy. It is our goal and intentions to provide you with valuable tips and insights from experts in the El Paso area so you too can stay healthy, fit, and energized. Now here's your host, Dr. David.
Hey El Paso, welcome to the show. Thank you so much for joining us. I've got an awesome interview lined up for you today. My name again is Dr. David Midoff, physical therapist. I'm the owner of El Paso Manual Physical Therapy. And I've got Julio Alcala with me. Julio is the owner of XR Imaging. I've known him for years now. He's fantastic at what he does, probably one of the best around. He is an expert X-ray technologist. He's got 16 years of experience, and I'll let him tell you more about all the stuff that he does and where he went to school and all that. But just before we get on the show, what we're going to focus on, our topic today, what Julio's really good at talking about is osteoporosis. And I'll let him go into the definition of it and a related condition called osteopenia, and he'll tell you some interesting facts about those conditions. But if you've got osteoporosis or osteopenia, you definitely want to tune in to every word that Julio has to say. And you might even want to give him a call and work with him so that you can help fix that problem, which is very fixable. A lot of people don't think that it is. And even in the medical field, they think that you're going to have it the rest of your life, but that's just not the case. It can improve. And if you do the right things and get the right kind of help. So without any more pauses here, let's talk to Julio. So Julio, welcome to the show. Thanks for coming.
Thank you, David. Thank you for inviting me. I'm glad to be here in your show and ready to share nice and valuable information with your listeners here.
Awesome. I'm glad to have you. Well, let's start by getting to know you a little bit better. I know you decently well, but let's hear about where you're from and where you went to school. How did you get into this field?
Well, a little bit of a story about myself. I always say this. They brought me here to the States, right? Mm-hmm. I was a teenager. I came to El Paso when I was 14 years old, mm-hmm. and I went to Eastwood High School. So mm-hmm. for those listeners out there, that are troopers. Once a trooper, always a trooper. That's what they say back then in Eastwood. So then after that, I went to EPCC and I enrolled in the X-ray program at EPCC. Throwing a little commercial there, but very intense and very high level of training that they have, those guys there at EPCC. So I became an X-ray technologist back in 2003. And I started working in local places here in different hospitals and clinics. Mm-hmm. And back in 2009, I decided to further my education in radiology. So I went and got my bachelor's degree in radiology science. I had the intention to become a radiologist assistant. Mm-hmm. But then I finished my bachelor's degree and, life happens. So then now I find myself owning an imaging center and providing X-ray services for the community here in El Paso.
That's awesome.
That's how I evolved here in this nice community.
Yeah, El Paso is a nice place. Mm-hmm. Well, tell us more about your company, XR Imaging. Can you tell us where it's at and just give us more information about it, please?
Yeah, XR Imaging, it's a diagnostic imaging center. Mm-hmm. It's located in the east side of El Paso. And what we do there is that we primarily offer very affordable and quality X-ray services, ultrasound services, and bone density scans as well. Mm-hmm. So we are primarily targeting those individuals that are tired of the conventional diagnostic services, right? Where you go there and you're dealing with insurances, they give you an appointment at per se 10 in the morning, you get seen at 11 in the morning, so you're there in large waiting areas, maybe listening to other people's stories and whatnot, right? But anyway, so we provide X-ray services, ultrasounds, mm-hmm. bone densities, and we are trying to improve the patient care and patient satisfaction by offering all of our clients and patients a one-to-one interaction with the technologist, and no waiting time. That's we're very good at the time that we tell you that you're gonna be seen. That's when you get seen. It's a nice comfortable setting, and we offer pretty much what most every diagnostic should do, right? Get quality and fast results to your providers.
Very nice. Awesome. And what's something that's particularly unique about your company?
What is unique about X-ray imaging is that we do offer that one-to-one interaction with patients. So the moment that you get there, you're gonna be greeted nicely, right? We value your time. We know that you're for most individuals, they're taking time off from work. They have family to attend to, right? So we welcome you nicely. We take care of you on time. And another very important aspect about our practice is that we like to educate patients. You're not gonna be one more patient to where you go there and we take a picture and then you're out. We're gonna take the time to do a very quality study, show you and educate you through the images. Now, we don't diagnose there because that's not our job, right? That's the doctor's job. So, but we're very good at showing you the images, identifying different aspects of your anatomy. If you have any questions regarding areas that it hurts the most or you have concern about, we show you that we're getting a quality picture of the area, making sure that the study is going to be complete for the radiologist to do a very precise diagnosis. So we do take that time per patient, and we allocated this time playing with logistics, right, to make sure that we don't go and make a long visit, right? It's effective timing, educational timing, and a nice comfortable setting.
That's awesome. So you actually get to show your clients their images or whatever it is that they're getting scanned by you?
Yes, definitely. So we work with digital imaging now, right? So the moment that I take an X-ray, the moment that Desiree does the ultrasound, the images are there in a digital format. So we show them to you. Also with these osteoporosis screenings, the moment that I finish scanning the lumbar spine, the hip, the image is there available for you to see. If you require or you want to have records of these images after the radiologist has dictated them and completed the report, we can gladly provide either a PDF file or just a digital format. We can burn a CD. You can take your images with you. So awesome. The patients has access to see their images at any given point.
And that's really cool, because I know as a physical therapist, we get people here in the office all the time that they had X-rays or an MRI or whatever imaging done, and they've never seen them before. They just didn't. Nobody showed it to them, and they saw the doctor, but the doctor just told them, "Hey, you have arthritis, or you have this whatever problem it is." But there's something about that individual just being able to see all the imaging and all the stuff that was done, because they can then have a visualization for what's going on with their problem, why they have their issue. That's really cool that you give them that opportunity.
Definitely,
to do that.
And then to elaborate a little bit more, it's a very touchy subject, because in school we are taught not to. Obviously, as a technologist, we should not be able, or we should not be telling what the patient has, right? Like diagnosing the patient. That's the doctor's job. But so most technologists are afraid to show the images to the patients, because the patients will then ask that question: "Hey, what do I have? Right? Do I have a fracture? Do I have this condition or whatever pathology it is?" But what we do is that we want to educate you we can show you the picture, and if there's a specific area that you're concerned, we will illustrate this area to you, so that when you go to your doctor, you have questions for your doctor. Hey, doctor, you know what? I got to see the X-rays, and I thought, I saw this area right here. Did you see the same thing on the images? Because most doctors, like you said, right? Most doctors will get the radiologist report and then tell you essentially what is on the paper without even seeing the pictures, right? So then by the patient being educated, and having those questions to the doctor, you just improve patient care, right?
Yeah.
I mean, we're just humans. A doctor can make a mistake as well, though. I mean, I know that a lot of doctors out there, that they don't accept that, but we're just humans. So, but it's also the patient's responsibility to ask questions to the doctor, to challenge that diagnosis and ask why. And seek for other alternatives, of course, right?
It puts them in a better position so that when they get to the doctor's visit, they're better educated about it, and they can ask better questions.
Correct.
And help the problem better.
Mm-hmm.
That's awesome. That's so cool. Powerful stuff. Well, let's get into talking about osteoporosis.
Let's do it.
So, what got you interested in osteoporosis, Julio?
Well, it's one of these conditions that presents no symptoms, David. So truly, there is let me throw these statistics right now, but 1/3 of the female population here in the United States, that's 1 out of 3, right? Females over the age of 50 will suffer or will develop osteoporosis.
Wow. So
the problem here is that we don't know when. We don't know if it's going to be at 50, 55, 60, 75, right? So then osteoporosis has no symptoms, and I got very interested on doing osteoporosis screening because throughout my years of experience in doing X-rays and doing bone densities, I came across with high volume of individuals, females the most, where they were just I don't know if I'm using the right word, but decaying in a way, right? I mean, they go there, they don't know they have osteoporosis. I get to see how bad their bones are internally, and for the most part, they pretty much ignore it most of their adulthood, right? Like through their adult life, they didn't know they had this. Yeah. So I kept just asking myself we should have a more proactive approach to help those individuals, because at 65, 75, it's already too late, right? You can definitely do something. And it's a very simple test. It's a very simple screening test that can definitely improve your quality of life.
Yeah. Oh, it's so simple. It's so fast. It's very quick, and you get tons of information right away.
Correct.
Well, for those of the listeners out there that maybe don't fully understand what osteoporosis is, could you just, in simple terms, define it for us?
Yes. So osteoporosis is a condition that affects your bones. And it affects the bones by making them very, very weak in the inside, right? So if I go and you go to any place, they shoot an X-ray, they're gonna take a picture of the outside of the bone. So what we refer to the cortex of the bone, right? And with this radiograph, with this picture, we can determine fractures, dislocations, and things like that. But we cannot diagnose osteoporosis based on a simple radiograph. Now, if osteoporosis is advanced, that means like if the bone is drastically weak, then at that point we can see it on a radiograph. Wow. But why would you want to wait, right? Why would you want to wait just to go with a radiograph to diagnose osteoporosis? So this is why technology like the DEXA scan. DEXA, it's an acronym for a very fancy words, right? Dual energy X-ray absorptiometry. So we just call it DEXA, right? Yeah. And DEXA, it's X-rays as well, but DEXA can measure inside the bone rather than just taking a picture of outside the cortex or outside the bone, right? Yeah. So then measuring the inside of the bone will let us know at any given age how strong or weak your bones are. So if your bones are weak, then we rely on this technology to find out how weak they are. If you could be on the phase before osteoporosis, which is osteopenia, and or osteoporosis. And osteopenia, think about osteopenia as like the phase before osteoporosis, when we start noticing a decrease in bone density, but it's a good time for you to take action to prevent osteoporosis. All right. And just talking a little bit more into it, we run with a system of it's a score, right? And most a very healthy individual at 30 years of age is going to have a score of 0. Okay, so then we're going to start comparing this score to these particular individuals. So if your score is anywhere lower than 2.5 points in this score system that we call T-score, you're going to be diagnosed with osteoporosis. Anything between 0 and -1, you're going to be diagnosed with osteopenia. But think about this, right? If you are diagnosed with osteopenia, you're 40, 45, right? You have at least a decade, maybe 2 decades to do something to prevent osteoporosis and essentially improve your quality of life as you age, you know?
Yeah. Oh man. So my takeaways from that are that osteoporosis, it doesn't hurt.
Correct.
It decays the bones from the inside out, and you probably won't even see much happen on the outside. You have to look at the inside. It's the density of the bones, and the lower the density, the worse your score.
Correct.
Once it gets to a certain point, then that's that's kind of the threshold of where they call it osteoporosis.
Definitely. That's exactly what it is.
Tends to affect women 50%, right?
Yes. So then the National Osteoporosis Foundation recommends an osteoporosis screening for all females over the age of 50. But that's a recommendation. Now, we do have here at X-Ray Imaging an authorization by the Texas Department of Health to do self-refer osteoporosis screening. So you don't have to go to your doctor and ask him, "Hey, doctor, I want to check my bones." You now can do it on your own, right? So then if you're 40, 45, you want to buy some time. You just want to make sure if you're listening, if you're in between maybe reaching female, right? Reaching premenopause or menopause, or you're through menopause, that will be a good point for you to start thinking, hey, what about my bones? Because you mentioned something very important. Osteoporosis has no symptoms. It's not going to hurt. So most individuals say, "Oh, my bones hurt," or "my joints," or "my back," right? And they might confuse this pain with weak bones, and that is not the case. There's no nerves inside the bones to trigger this, a pain effect to let us know, okay, your bones are weak, right? Yeah. So then we relied on technology like DEXA to truly measure these values, these bones, right? Yeah. But in being proactive on your health. If you scan yourself with a osteoporosis screening at early age, you're even better, right? You don't have to wait for your doctor to request this. It's pretty much informing the public that you have the right to be proactive with your own health, and primarily is going to affect females, definitely, just because of changes in hormones and through menopause. Any deviation of estrogen is going to and we have other risk factors, but primarily the estrogen. As you decrease estrogen, you increase the risk of developing osteoporosis.
So that's probably especially helpful, like going in before 50 if you're a female, if like your mom or your grandma or somebody, other people in your family have known osteoporosis, like they've been diagnosed with osteoporosis, then that's probably somebody who should say, hey, maybe I should go get checked. I'm in my 40s. I should probably go take advantage of this ability to go see somebody like you and get scanned now for osteoporosis so that they can be prepared for the future.
Correct.
That's cool. So let's talk about, just kind of a tangent here. What could happen to somebody that has progressive osteoporosis? What are the problems people run into? Because it doesn't hurt. They're not going to know that they have it necessarily. They might have back pain or hip pain or other stuff, but that's more related to their joints or muscles or something else. But the inside of their bones, what you're saying, is not going to hurt. But let's say the osteoporosis keeps getting worse. What could happen?
So worst case scenario, right? It's you having a fracture on your spine or you fracturing your hip. So we know by statistics that those hip fractures primarily are quite dangerous, right? There's a high statistics of individuals who broken a hip. They ended up in a hospital and they don't make it. As you know, it's drastic. The numbers are drastic. So then, who might suffer from a hip fracture? Well, we know that by accident, most people can, any type of trauma, but individuals with weak bones, and we're talking about the elderly here, right? They're taking a shower, they sleep, they fall, and if they have weak bones, guess what? either the back or the hip. It's going to be one of the areas of primary, that fractures. Okay, so we see a lot of fractures also on the wrist, because just by tendency of landing ourselves, we put our hands correct. But the one of most concern is going to be spine fractures and hip fractures. So then, as we age, we want to age with a good life quality, right? Of quality of life. Like, we want to be doing things, enjoying our grandsons, enjoying those, a good day, be walking.
Being able to go on a vacation.
Correct, yes, definitely.
Sightsee, walk around.
So then what we want is prevent that from happening, right? Making sure that the public here understands that osteoporosis is truly a thing to consider, and it's quite easy to diagnose and to prevent. It is very hard to at early age, as we as they diagnose osteoporosis, to recover from it. So the younger that you are, the better you are. If you are proactive, and then you're just pretty much improving the outcome towards the your late years, I guess I should put it like that.
Yeah, and just to give you, the listeners, a perspective from the physical therapy side, because I see people that have had hip fractures and spine fractures, that kind of thing, rehabbing, recovering the strength and mobility and ability to walk and do normal life things sucks. It's terrible. And a lot of these people have had a hip replacement because they couldn't salvage the hip bones. Some will get a pin surgically put in to stabilize the fracture in their hip, and their life changes dramatically. So yeah, many of them pass away, unfortunately, because of all the changes that happen after breaking a hip or fracturing the spine. But they all of a sudden, if they lived, usually they're attached to a walker or a cane for the rest of their life. And people hate having to carry a walker around. You have to put it in the trunk of your car whenever you leave. It gets caught on things. It's miserable. The best is if you can just have your own body and not have to carry any sort of walker or cane and get around and do whatever you want. And yeah, even better, like you said, quality of life, being able to say, I'm going to get on the floor and play with my grandkids and not be afraid that I'm going to injure myself or that I dealt with this fracture that I got, years back or last year, and I can't do that anymore.
Sure.
So yeah, the dealing with the problems of osteoporosis is not fun. It's just that it happens suddenly, and it is terrible once it comes. But kind of let's talk about the other end of that. What could be done to prevent it from getting worse, or maybe even improve it?
So in understanding first the risk factors, so we classify them by controlled risk factors and uncontrolled risk factors, right? So sadly, the uncontrolled risk factors will be gender, age, right, and genetics. So then, right there out of the bat, females will have stuck right there, right? So osteoporosis is by genetics is going to target females over the age of 50. So you cannot control those two. And then, like you mentioned before, if your parents, your grandparents had osteoporosis, that doesn't mean that you will have it, but the risk increases, right? So if you cannot control the age, if you cannot control your hormones as going through menopause, the only thing that you can control is be proactive, right? Go get checked. Go call me, right? You know what? If you're listening to this right now, just get your phone call at 915-613-2748. We'll help you with a simple osteoporosis screening. It's a very simple test that brings a lot of value. You want to know if your bones are strong, to be cautious, be aware of this and enjoy your life. And if they're not, take it as it is, right? But with the attitude of improving. And then we will offer you a second scan. We will offer. We'll refer you with the specialist that can help you to improve your bone density, and then you'll come back 6 months, 12 months to do another scan and see how you're improving. But that's essentially a way of contemplating this now. Excluding these uncontrolled risk factors, because you cannot control them, right? We know that sedentary individuals are more prone to develop osteoporosis. The bones, we call this process osteogenesis. So it's like the generating new bone or the beginning of building bone, right? So then this osteogenesis process gets stimulated when there's high impacts on the bone. So we know that individuals who practice high impact exercises or resistance training they do better. They minimize the risk of developing osteoporosis. So if you're young, you are active in the gym, that's going to be a benefit for you in preventing developing osteoporosis. We also know that very acidic drinks such as Coke, excessive coffee, many soft drinks, obviously, right, that carry a lot of the pH is very acidic. It will start affecting on the long run. I mean, I told this one time, and then a patient told me, "What do you mean if I just drink 1 cup of coffee?" I'm like, no, I didn't say that. Enjoy your coffee, right? But in the excess, on the long term, it's going to have an impact.
I'm putting my coffee down right now as we speak.
No, I love coffee, so I just being aware of the putting myself on the limitation, be cautious of what I'm doing, right?
I'm about to drink water instead now.
But yeah. So then think about these little things that you can do on early age, right? Watch your soft drinks, making sure that you're not drinking too much acidic or high acidic drinks. Then be active. Not necessarily cardio, okay? A lot of people think, just by going and walking around. So, matter of fact, there's this very interesting report, and it's a study that came in 2007 in UCLA. So they got, and it was a short sample, right? So it was only 40 individuals, right, with certain characteristics, but they split it in 20 groups of 20s, okay? And the group of 20 patients, it was pure females over the age of 50. They had them do cardio, just pure cardio exercise. And then they were tracking how their density will progress within 24 months. And then the other 20 did resistance. Well, those that did resistance and high impact develop or maintain better bone density compared to the ones that were just doing cardio. Okay, so then the type of exercise is also very, very important. All right.
And just to speak to it as from a physical therapist standpoint, a lot of people as they age, so if you're 50 and up, people tend to have back pain or hip pain or things hurt, and then having this understanding of, all right, well, I got to go do some sort of resistance training. That might mean weightlifting or something else. And it depends on what the individual likes to do. That's what we guide them towards, just how to do it in a way that's helpful for them. If they're running into back pain or hip pain in the exercise they want to do, then talking to somebody like me is a huge benefit, so that a physical therapist can guide them on the right exercises.
Definitely.
And it might be that they're not ready to lift weights today. They need to do some other stuff leading up to it, so that they can begin to hit the weights a little bit harder and be safe about it and not get injured some other way. But it's true. So many, we see clients here that they end up, going to go do weight training, and the way I tell people is just like you get calluses on your hands from, working with your hands a lot, our other tissues respond similarly. Our muscles will get thicker, our tendons will get thicker, and our bones get more dense.
Correct.
It's just a natural response that our bodies have to extra forces you put on them. But what I see from our clients is it's uncomfortable to lift weights and push yourself kind of hard, and it's kind of easy and very gratifying to get on the treadmill or the bike or whatever and say, I burned 500 calories. I feel good about myself. And you don't get the same kind of response when you go lift the weights. It's like, well, I don't know how many calories I burned. And if you actually look it up, it's not that many calories, but the benefit that you don't feel right then and there is your bones get stronger and your muscles get stronger and all that.
Yeah, no, and this is one of the things I encourage most individuals because they go there and they express, I am in pain, or my back hurts, or my joints hurt, right? How can it's going to be impossible for me to do exercise. But they don't realize that physical therapy it's a science, right? Like you guys, doctors, you go through school, you get a very, very specific training on how the body works and ways to what to do to supplement for a specific type of movement or exercise. So, that I know, I understand, pain is pain, and it could be relative from patient to patient, but seeking help is not, right. You need to decide, right, whether you truly need that help, and then seek individuals like you, like, okay, I want to improve my health. I know I'm hurting, but yet I know I need to do something, some type of movement. I want to go to the specialists. Who are the specialists that will tell me what movements to do, how to do in my body mechanics? With all the respect, your primary doctor more than likely is not going to do it.
Yeah.
Right. So then seek individuals like in physical therapy, like like you in this particular
find
case.
the right person. It's a whole process. Yeah, doctors tend to be specialists in medicine, and everybody in the medical field kind of has their own specialty, and so yeah, just find the right person for the problem that you're facing, and that's where you're going to go. Find the best help. Correct. So let's talk about a specific client of yours that you can think of that had osteoporosis and has maybe had a good outcome. Do you have anybody like that?
Yes, definitely. So I had this patient, and through this self-referral program that we have, okay, this patient very proactive, very motivated to improve her health. So she goes there. She was referred by her primary doctor. We ended up doing just the osteoporosis screening. So it turns out that she had osteoporosis, but very severe. Now you will see this patient, walking normal, right? I mean, she's just fine. She wasn't complaining or anything. But she calls the office back, right? And a couple of weeks later, and she says, you know what? I was there. I had my bone density. I follow up with my doctor. They diagnosed me with osteoporosis. They put me on this medication. But I want to do something else, something extra to improve my health. Is there any recommendation? We talk about some things when I was there in the office. Can I do something else, right? So then I went back on talking to her about the recommendations, correct? So then I told her, okay, once you start implementing these basic things about, stick to the treatment that your doctor obviously, recommended, because you need that help to rebuild that bone. But improve, do physical activity, right? Start limiting your acidic liquids, right? Also start improving on your diet, correct? And then and so then she went on and did these changes, right? She does follow up 6 months later. Now I don't know if she ended up doing something more in the natural or the I guess I think it's called osteopathic, right? Osteopathic, right? Yeah. So she's sick for some type of herbs, and then some type of different teas, right? Because she didn't want to be on this medication long term. Yeah. Well, I was in my 16 years of experience, right, doing X-rays and doing bone densities, I never seen a drastic increase in bone density in a short period of time of six months, right? Yeah. Now, when we look at the values, right, maybe right now it wouldn't make sense, right? But just 1 point in this T-score, and this is scale of what we utilize this T-score, right? Yeah. It's a huge improvement. Yeah. We see an increase of 1 point on the T-score maybe within a year and a half. But for this lady to have this improvement within 6 weeks, it was amazing, right? So then once again, it's stick to what you're, respect the treatment that your doctor is giving to you, but do something else, right? Try to do that extra, those basic recommendations, and then science and medical, the medical or medicine tells us that there's no cure for osteoporosis. There's only a treatment, and we can definitely prolong the damage of or extend the timing that osteoporosis is going to damage your bones, right? Through medication. But I truly feel that by improving your quality of life, you're truly you do have control of osteoporosis. You manipulate how strong your bones can get by being proactive and just simple life regular life activities, right?
Oh, that's awesome. That's a great story. And I think it's kind of like the idea of there's no cure for osteoporosis implies that it's a like a disease, or like it's a virus, or like something that you catch.
Correct.
And it's not. It's more like putting on weight. Like, I mean, you don't
condition, right?
Yeah, it's a condition. It's the state of your health. You know, you don't get a bug and then all of a sudden get overweight or obese. It's because of the way that you live. It's because of how you eat and what you do. And I think it's the same thing with osteoporosis. It's your habits, the way you live that puts you in an osteoporotic state or not. And that's what this lady changed. And so when doctors give you a medicine for osteoporosis, I think it's easy for some patients to go into the thinking of, oh, this is what's going to fix it. Just like when I went to the doctor before and I had a sinus infection and they gave me antibiotics and it fixed it.
Correct.
But that's not how this works. It's medicine and diet and exercise and other factors that might be in your life that all have, just like with obesity or putting on weight, it's the same way that you got to treat it, and you have to maintain it over time.
And one of the reasons that I share this story about this patient is because we run by protocols, right? So then you go to your doctor, medical doctor, right, primary physician. They order any type of test. In this particular case for osteoporosis screening, the protocol it's one screening or one test every 2 years. Now, if you're being diagnosed with osteoporosis, we're gonna do one exam or one scan every year, right? But that's the protocol. But do you have to? Do you have to stick to that? Well, if you're paying with insurances, you're gonna have to, because insurances follow this protocol, right? They're only gonna pay, if you have osteoporosis, they're gonna pay once a year. If you don't, they're gonna pay once every 2 years, right? But the nice thing about individuals like this is that they don't settle with just one diagnosis and one simple decision. Like, okay, you have osteoporosis, take this pill, that's it. No, she went on and took care of her health by doing the things that she had to do and not waiting for these next year or next 2 years. She realized that we do have this authorization to do self-refer. So then she went back and measured herself, and there it is, right? Like she now knew that she's on the right path to improve her health, right? She didn't have to wait another year or 2 years, right? So be proactive. Yes, doctors are great to take care of certain conditions, but you primarily have to have control of your own health, right?
That's awesome. Well, when should somebody in El Paso reach out for you for help with osteoporosis?
So we've been primarily talking about females, but we also men also develop osteoporosis. The statistics are or the ratio is a little bit less. So 1 out of 5 men over the age of 55 will develop osteoporosis. Same concept, we don't know when. So 55, 60, 75, right? We don't know when. But so essentially, if you are a female over the age of 50, you're listening to this podcast, you're a female over the age of 50, you never check your bones. Your bones never hurt, right? Do yourself a favor, be proactive, right? Go and get your bone checked. It's a 5-minute scan that brings a lot of value to understand how your bones are, right? And if you're a man over the age of 55, you never got, and I guess this is also a cultural thing, okay? I get this a lot about Hispanic men over the age of 50 that, oh, I feel strong, I'm this macho man, I get to lift, very heavy things, I'm out there, but once again, it's a condition that is not gonna discriminate on gender, okay? In that particular sense, it don't matter what, or I should say on ethnicity, all right? Don't matter, just having weak bones is not a matter of whether you're a macho or not, so go get checked, it's good. So now, if you're listening to this podcast, right, and you're a female or you're a male that are in your early 40s, you don't have to wait. You don't have to wait into the recommendations. You can give us a call, find out, give us a call at 915-613-2748 and schedule your bone density or osteoporosis screening. We'll be gladly to take you in, explain to you what the results are, and show you how your bones are. So that way, you can improve your quality of life.
That's awesome. Was there any helpful tips that you share with clients that they usually don't know before they come in and talk to you and meet you?
Any tips that I wanna share? I mean, when you go see your doctor, right? Your doctor orders a specific test, whatever it is, right? We love educating the patients. We love educating the patients, and one of this part of the education is the fact that you have rights as a patient, as a consumer, as a matter of fact, right? So if a doctor sends you to a specific place, they give you the order or the referral form, right? More than likely they're doing it because they have a good relationship with this particular place, right? But you might go to this place and you might experience that they are not greeting you correctly, right? You might experience that maybe the technologists didn't give you the time that you deserve, right? As a consumer, as a client, right? In the state of Texas, you have the right to choose the place of your, that you best think is best for you, right? Yes, we love doctors, making these referrals, but ultimately the patient has a right to choose where to go. So what we offer here is that if you're not happy with this place that that your doctor is sending you, you have options. Call around, compare prices, compare rates. Ask about reviews online. Now it's very easy to get on Google and find out about the reviews, different places, right? So coming to us, if you're concerned about, you are an individual that are health and fitness oriented, and you just want to step it up, get to know your body at a deeper level. Call us, and we're able to help you in understanding how your bones and your body composition is. That way you can improve your health and your fitness as well.
That goes into the next question. We kind of already talked about this before we even started the interview. Is I know you offer other services besides osteoporosis screening. We mentioned a little bit about the DEXA scan, but it gives other information besides the bone density. Could you tell us a little bit more about that?
So this scanner that we have, this DEXA scanner, not only measures the bone, but it also measures your visceral fat. Visceral fat is the toxic metabolic active fat around your organs. A lot of people ignore that. So we usually, because we can feel what is under our skins, right? We pinch, we grab ourselves around our bellies, right? So we can say, oh, I have I'm overweight, or I have this X amount of pounds of fat. But most people ignore that internally, underneath our abdominal muscles, on top of our organs, we have this very vicious, toxic fat that is there. The more fat that you have, the more chances of developing cardiovascular diseases. More visceral fat you have, the more chances of developing metabolic syndrome and diabetes type 2 or type 2 diabetes. So then our DEXA scan can also measure this and let you know. So we know that the recommended value of visceral fat is less than 1 pound. Anything more than 1 pound is excess visceral fat.
Wow.
Sadly, listen to these guys, okay? Here in El Paso, we know that we are considered a very obese community, right? The average of visceral fat here in El Paso is 3.5 pounds to 4.5 pounds of visceral fat. The recommended value is 1 pound or less, right? So then, this is I wish you can invite me to another podcast to talk about this visceral fat, but DEXA scan will measure this as well. All right. We can also measure we have the ability to measure your muscle. Find out how much muscle you carry, and this is an important value for muscle symmetry. For those of you out there practicing any type of a sport, any type of physical activity, muscle symmetry is it's an amazing thing that most people ignore. So we know that the body works best when it's symmetrical, and essentially what's going to be doing the work is the muscles, right? So you minimize injuries by staying symmetrical, right? How much muscle you're carrying on one side compared to the other. We're talking about your hands and your legs, so we can measure that as well. And then the last thing is because of this BMI, the body mass index, is it's a formula
Terrible.
developed back in the 1800s, right? But anyway, so you go to a doctor, they take your weight, they take your height, they tell you you're overweight, when in reality you might not be. So the DEXA scan can let us know your true classification of weight per se by accurately measuring your body fat percentage.
Yeah. And I've had this scan done myself. You did it on me, and I even had it back when I was in college, so I already knew about it. And it's fast. I mean, you just lay down on this little bed. You even put a pillow there, and you're not in a tube. You're not. It's not like an MRI machine. So just to paint the picture from somebody who's done it, it's an open area, and there's this arm that slowly goes over you, and it's maybe a foot away from you, and it's not. It doesn't feel like scary in any way. There's nothing loud. It's very quiet. It's almost like it's just like I mean, it makes probably about the same amount of noise as like a printer might make.
Correct.
And that's it. And the whole scan itself is over in within minutes. It's maybe like 5-10 minutes.
Yeah, depending on the health. I mean, on the health and the height. So tall individuals is going to take anywhere between 6 to 7 minutes.
Yeah.
So all depends on that. But on the average, anywhere from 4 up to 7 minutes, your waist scan, and you describe it very nice. It's very it's not invasive whatsoever. So you're completely dressed. You don't have to. The recommendation that we want to make sure is that we don't want you wearing metals around your obviously within your clothing. But if you go there with a nice comfortable clothing without metals, you just hop on the scanner and it's gonna start scanning from head to toes, and that's it. No pain. You're not gonna see or feel anything. The radiation amount, that's another issue. We're concerned about radiation. We always should be concerned about radiation, right? But this scanner gives very minimal quantities of radiation in a full scan. Compared to an X-ray, compared to a CT scan, it's almost incomparable. So then the scan is very, very safe. Yes, we take precautions nonetheless, because once again, we're working with radiation, but that's our responsibility as a technologist to make sure that your scan is safe, that is high quality, and that we're utilizing the least amount of radiation possible.
Yeah, so it's very easy to do, and the information you get is invaluable. And I've seen people that are into the extremes of people looking at their body fat and muscle mass and all that. You probably see like the bodybuilders, the people that are doing fitness competitions, and they need to look a certain way and get their body fat down. But even your everyday Joe that just wants to get healthier and lose fat, put on muscle, they're not interested in competing, the DEXA scan gives you top-notch information to be able to meet those goals and measure as you're going along.
I utilize this phrase that and I'm pretty sure you have heard this before. What gets measured gets managed, right?
Yeah.
So most individuals, as you described, and they go into start doing exercise or trying to improve their fitness. But if you're not assessing your body, measuring your body, how can you improve? Yeah. I mean, you can go by looking yourself in the mirror, but that's an external look, right? What's happening inside? You're gonna rely in different technology. So then. The other thing is let me touch this. This is very, very here in El Paso, right? I not too long ago I was driving on I-10 and I see this billboard about weight loss challenges, right? And there's and I'm not bashing anyone here or anything like that, right? No fitness centers, but they're very common. That's what I'm trying to say. Weight loss challenges are very common. I support them because they bring you at least get you motivated to do something.
Right.
The problem with that is that individuals losing or places that promise you that you're gonna lose 20 pounds, 30 pounds within 4 or 6 week period of time. You can do it. They have the system to allow you to lose that drastic weight. The problem with that is that as you lose weight, or you just go by your scale, you don't know what you're losing. You don't know if this 20 pounds, 30 pounds, you don't know if it's just mainly fat. You don't know if it's a combination of fat or muscle. Or even worse, you don't know if it's a combination of fat, muscle, and bone density, correct? So then you might feel great, you might look great losing 20 pounds, But what are those 20 pounds? Did you maintain your bone density? Did you maintain your muscle as well, right? Now, if you decide to do these type of challenges, they're very, very, it's almost like a trend, right? Everyone is doing them. I encourage you to measure yourself, create a baseline measurement, see how you are before your weight loss challenge. And I'm not talking about measuring tapes, okay? Or even calipers. You gotta find a technology that measures inside of you, gets you quantities of your tissues. Then go on and practice your diet, your training, whatever they're offering to you. Then follow up with a scan and see what you lost. Because look, if you're making an investment in time and money to these places, or it can be an online thing, right? But if you're paying and they're not, these training or nutrition is not yielding the right results, then you're being, they're tricking you in an essence, right? And then more than that, they potentially affect your health. So then be wise about that. And the other thing is that whatever weight that you lose, you want to sustain it. You want to maintain it. You don't want to lose weight in 6 weeks and then just to see yourself in 4 months, right? Gaining it all back. So the DEXA scan will let us know realistically how much can you improve in a next period of time, so that you leave the practice understanding, okay, this is a realistic approach. Once I meet these benchmarks, I'm gonna be able to maintain my weight loss. Not by 4 or 6 months, no, but on a long term, right? And that's what you want. But you need a tool. You need a tool to measure and to determine your values internally. The best technology that is out there is DEXA. Nothing is gonna beat DEXA. Yes, there's some other commercial devices, but there you're dealing with a large margin of errors in terms of the numbers. So, decide what you can afford, what you can, and you know what? Check us out. Visit xrimagingep.com. Check our rates there. Very accessible, very affordable. This is nothing, that it's gonna be out of the pocket of most individuals. It's something that if you are spending X amount of dollars in a weekend, to go have fun, pretty sure you can afford our scans. Definitely.
Yeah. Well, cool. Well, so you mentioned the website, and you mentioned the phone number as well. Can you tell us the phone number one more time in case somebody wants to reach out to you and get in touch?
Yes. So you can reach XR Imaging at 915-613-2748. You can also find us on our website at xrimagingep.com. And we are in social media, Facebook and Instagram. You just can find us the same way as XR Imaging.
Awesome. Well, great. Awesome awesome interview here for the podcast. If there's anything else you want to let us know before we wrap up?
For those listeners of you, right? If you are interested in getting a full body composition analysis, this is the analysis that we talk about, where we analyze your bones, we analyze your fat, your visceral fat, your body fat, your visceral fat, and your lean mass. We call this a body composition analysis. So if you're interested in getting this analysis, we offer you a 10% discount.
Awesome.
Only if you mention this podcast, right? That you listen to your podcast and then make a reference of your practice.
Awesome. Fantastic. Thank you so much for that discount. That's huge. Well, great interview, Julio. Thank you so much for your time and your knowledge and wisdom. And we look forward to possibly bringing you on the show again sometime in the near future.
Yeah. Any other topic that you can think of that can bring value to your listeners or to your audience, please think about me.
Absolutely. Bye, guys. We'll catch you next time.
Thank you, guys.
Thank you so much for listening to the Stay Healthy El Paso podcast, brought to you by El Paso Manual Physical Therapy, where we help El Pasoans get away from taking pain medications, avoid getting injections, avoid surgery, and keeping up an active lifestyle. If you'd like to learn more about what El Paso Manual Physical Therapy can do for you, call 915-503-1314 or visit our website at epmanualphysicaltherapy.com. Mention this podcast for a free discovery visit valued at $100. If you enjoyed what you've heard, please be sure to leave a review on iTunes and follow the show on your favorite listening platform so you won't miss an upcoming episode. Tune in next time to get the best health tips from experts in the El Paso area.